Psychiatry hospital treating mental health patient. Is it enough? No. They need psychosocial rehabilitation. Even though they're taking medications or any other therapies, their recovery journey is not fulfilled. In the psychosocial rehabilitation, PSR focus on their quality of life, independence, community integration and all. Myself Sumar, I am the student of occupational therapy. Rehabilitation is not done in one area, it is done in various places. In our video, we are going to discuss three places: daycare centers, sheltered workshops, and halfway homes. Okay. First, daycare centers. The name itself says they are caring only daytime. During night, they are going to their own home. Daycare center is a safe and nurturing environment to the psychiatric patients. In daycare center, the patient can access to range of therapeutic services and also connection with the outside world, because during night they are going outside to the home. Here multidisciplinary approach, which means many more people are there: psychiatrists, psychologists, social workers, occupational therapists, physiotherapists. So they are assessing the individual needs and they are and implement that. Medical management, psychotherapy to life skill training also available in daycare centers. Okay, these daycare centers offer structured programs. So according to the person need, the program is structured. Here many more combination of the individual therapy, group therapy, psychotherapy, medication, recreational activities, life skill training are all in a structured way. So the day is just scheduled and structured in the way to provide a balanced therapeutic intervention according to the patient. And also they are giving the social interaction during therapies. And therapeutic interventions are available in daycare centers. So these interventions addressing their mental health symptoms and overall well-being. In these sessions, the patients are allowed to explore their thoughts, feelings, and experience in a confidential setting. So their thoughts are not going to the outside. So in a confidential setting. And group therapies also provide opportunity for peer interaction, skill building, and interpersonal learning. And medical management. So what are all the drugs needed for them are also prescribed by the psychiatrist, and these are all implemented in the daycare centers. And this psychoeducation is nothing but it is a counseling in which the person can able to show their problems in their mind, and after that they can able to actively participate in everything. In life skill training, communication skills, stress management techniques, time management, coping skills for daily challenges are all trained. Recreational activities. So to promote socialization and relaxation, the recreational activities are given. Activities such as art therapy, music therapy, exercise, gardening. In these, the person going to outside and express their feelings, and they are going to enjoy, and social engagement is well. And community integration. The daycare centers encourage community integration by facilitating connection with the local resources. They collaborate with the vocational rehabilitation programs, community organizations, educational institutions, employment services. So by these, the community integration is built up. Continuity of care. So the daycare center is not enough by the daycare center. They continue. The care is continued with the hospital and OP clinics and community center, primary care centers. So the care is continued. So the long-term recovery process. So are all supported by the this continuity of the care. Okay, these are all given by the daycare centers. Next, we are going to see about sheltered workshops. Sheltered workshops are specialized vocational rehabilitation program. So what is vocational means? Work. So work rehabilitation program in which work needs some skills. So these abilities are trained in the sheltered workshops without judgment. So in workplace, someone is going to judge you by your work, but these sheltered workshops giving you an environment to train vocational abilities. Here, structured work opportunities and supervised work opportunities, which means someone going to supervise you and teach you and make you learn the job skills and gain work experience, and you are going to build confidence in your abilities. So sheltered workshop first giving safe and supportive environment. So the atmosphere is designed in a way non-judgment. So no one going to judge you in your work skills, and everyone going to understand your abilities understandable way, and allow participant to work by their own pace, and the person can receive assistance when he needed. Here, vocational training, the job-related skills and abilities are trained, such as packaging, manufacturing, food services, gardening, crafts, and are all trained in a structured way. So the individual ability and interest are matched, and the sense of competence of the person is increased by the training. Supervised work opportunities. So someone going to supervise you and going to assist you. So here the work tasks are modified or simplified by the accommodation of the individual's cognitive, emotional, and physical needs, and individualized support. So for every person there is a support is there, so they going to train, and job coaches and encouragement are all provided, so they have a peers, so they can share their work experience, and other person also can share their work experience, and they can make a friendship, and they going to interact, and they going to socialize. And flexible schedule, so the person can able to full-time work or part-time work or 1 hour work, so that like they can able to flexible the schedule, so based on the individual energy level and based on the personal commitments, the person can modify their schedules. And transitional support means the person is in work shelter workshop and they are going to be the job, so they need resume and they need a job placement, so these assistants are provided by the sheltered workshops, and the sheltered workshop is integrated with the mental health treatment. So if the person need any other further treatment, they can also easily contact with the mental health treatment programs. So next, halfway homes. What is halfway homes? We'll discuss. So halfway homes are also the part of the psychosocial rehabilitation. So the person is in the hospital and the person going to be the home. So between these halfway homes are available. So in hospital, the integration with society is reduced. They are just getting the intervention and they are getting the structured environment. In halfway homes, they are going to interact with the society and also they have the structured environment and they have a supervision to transition to go back to the society. We can say halfway homes are the transitional environment. So it's just connecting the psychiatric hospital to the society. Institutionalized care and individual living in a community. So these are all connected by the halfway home. Okay, what are all they giving structured support according to the individual needs? Medication management, individual therapy, group therapy, psychotherapy, life skill training, vocational rehabilitation are all provided, and ADL assistance is also provided in a structured way. So this is a structured support, and 24-hour supervision because they are going to be the community. So in community, no one going to supervise them. So they are the individual. They can't do anything in the society, it may be antisocial. So to prevent these, 24 hours supervision is there on the person and their safety and well-being are ensured, and guidance, support, and crisis intervention are also given in the halfway homes. Individualized treatment plan. So this treatment plan address the individual specific mental health needs, and it is developed by the collaboration and also input of the patient, also offers community integration because they are going to be the community. So the residents are encouraged to participate in the community activities, social event, and volunteer opportunities because they are going to be the society. So volunteer opportunities are provided to the residents, and the grappling skills are developed to the individuals, and life skills are developed, and sense of belonging are developed to the patient. And peer support. So the group therapy, so the peer are also developed, so the friendships are developed and interaction between them also happening, and gradual independence, so they are just come from the hospital, so suddenly the independence is not there, so gradual independence, they are going to gradually independent from the so aerial. So first they need minimal assistance and like that, so severe more assistance, mild assistance like that, so gradual independence is there. Goal oriented approach, so the mental symptoms so are all focused, and to reduce the mental symptoms what are all doing, so that goal oriented approach is implemented in the halfway homes. And length of stay, so from individual to individual it is vary because of the severity of the person, so some person can stay within a week and they go back to the community, so some persons may stay in weeks or 3 months like that, so months. So length of stay is vary according to the individual. Okay, these are all the psychosocial rehabilitation. Not only these three, many more centers are available for psychosocial rehabilitation. So in our further videos, we are going to discuss many more psychosocial rehabilitation centers. Be proud to watch our video. Thanks for watching. Don't forget to subscribe. Bye bye.